So today we will discuss about the breast clinical anatomy regarding the breast. The upper and the outer quadrant of the breast is frequent site of a carcinoma. Let me see. We divide breast into the four quadrants: upper outer, lower outer, and upper inner, lower inner. Then this upper outer quadrant is most common site of a breast carcinoma. The first lymph node draining the tumor bearing area is called sentinel node. And abscess may also form in the breast, may require drainage. It also requires drainage. You all know what is abscess. Abscess is pus filled area. It also requires drainage. Following facts about the breast clinical anatomy you should know. Incision of a breast may rarely avoid cutting the lactiferous ducts. The cancer cells may infiltrate the suspensory ligament and the breast become fixed. Contraction of ligaments can cause retraction or puckering, means folding of the skin. This is important point. Infiltration of the lactiferous ducts and their consequent fibrosis can cause retraction of the nipples. Obstruction of superficial lymph vessels by the cancer cells may produce edema of the skin. Superficial lymph nodes by the cancer cells may produce edema of the skin, giving rise to an appearance. Skin appearance like that of a skin of an orange, pure orange appearance. This is also called pure orange appearance. And because of the communication of the superficial lymphatics of the breast across the midline, cancer may spread to another breast. This is both the breasts are connected by the internal mammary lymph nodes. We will see into the image after all this. Because of the communication of the lymph vessels with those in abdomen, the lymph vessels present in the abdomen, cancer may spread to the liver and ovary also, producing secondary cancer there. Apart from the lymphatics, cancer may spread through the segmental veins also. In this connection, it is important to know that the veins draining the breast communicate with the vertebral venous plexus also, venous plexus of the vein. Through these communications, cancer can spread to the vertebrae and brain also. Carcinoma usually arises from the epithelium of large ducts. Self-examination of breast can be done in following ways: inspect for the symmetry of the breast and nipples, and what will be the color of the skin. We also see the retraction of the nipple because it is sign of the cancer. Discharge from the nipple after squeezing it, and we will palpate all four quadrants with the palm of the hand for any palpable lump. Raise the arm to feel the axillary lymph nodes, and revealing the cancerous mass, we will do the mammogram also. And FNSC is a safe क्विक मेथड है डायग्नोसिस ऑफ लीजन ऑफ ब्रेस्ट का. तो लिम्फेटिक्स से कैसे स्प्रेड होता है ब्रेस्ट कैंसर? ब्रेस्ट का जो अपर पार्ट है वो पेक्टोरल लिम्फ नोड से होता हुआ सेंट्रल लिम्फ नोड में जाता है, एंड वहाँ से वो अपाइकल लिम्फ नोड में जाता है. देन इट विल ड्रेन इनटू द सुप्राक्लेविकुलर लिम्फ नोड्स, एंड बोथ द ब्रेस्ट कम्युनिकेट टू ईच अदर बाय द इंटरनल मेमरी लिम्फ नोड्स, and vertebra is also connected by these lymph nodes, and this lymphatics also goes to the liver and the ovary also. And this is the vertebral venous plexus. This is not very much important, and this mammogram shows cancerous lesions. Retracted nipple is sign of a tumor in the breast. It is sign of the breast. You can see for the retracted nipples. Size of a mammary gland can be increased by putting an implant inside the gland, and the size can be reduced by the breast reduction surgery. Cancer of the mammary glands is the most common cancer in the females of all ages. It is more frequently seen in post-menopausal females due to the lack of estrogen hormones. Self-examination of a mammary gland is the only way for early diagnosis and appropriate treatment. Mastectomy will do medical term for surgical removal of the one or both breasts, partially or completely. A mastectomy is usually carried out to treat the breast cancer. And lumpectomy is the only removal of a tumor. Mastectomy is a broad word. Radical mastectomy surgical procedure involving the removal of a breast, underlying pectoral muscles and lymph nodes also. Clinical anatomy problem. 45-year-old woman complained of a firm painless mass in the upper lateral quadrant of her left breast. The nipple was also raised. Axilla lymph nodes were palpable and firm. It was diagnosed as a cancer of a breast. Then two questions: where does the lymph node from upper quadrant drain, and what the cause of retraction of the nipple? Let me see the answer. The lymph from the upper lateral quadrant drains mainly into the pectoral group of the axillary lymph nodes, and the lymphatics also drain into the supraclavicular and infraclavicular lymph nodes. Blockage of some lymph vessels by the cancer cells can cause edema of skin with dimpled appearance. This is called pure orange appearance. When cancer cells infiltrate the suspensory ligament, glandular tissue of drug, and there is retraction of the nipple.